Hey there, my name is Julia Gross, and this is my level 1A fieldwork video assignment. I shadowed Kinsey Day at NHC Westmead. So here we go. Question number 1. Describe an occupation-based goal you think would be essential for a particular patient scenario. What treatment activities would you recommend to achieve this goal and why? Okay. So let's take somebody, maybe let's say post-surgery rehabilitation. Let's say we have a patient who has a lot of respiratory issues with breathing, so they don't have high endurance, they can't move as quickly, maybe they're connected to a respirator or a ventilator for oxygen. So for somebody like this, I would say, a good occupation-based goal would be working on getting them to be able to perform grooming activities without losing their breath. So making sure that they're able to get up, walk to the restroom, they're able to stand up long enough to brush their teeth, brush their hair, making sure they're able to move around and do their activities of daily living without losing their breath. So, what treatment activities would you recommend to achieve this goal? Well, I would say treatment activities using a bathroom or a kitchen at a facility to practice performing activities of daily living, such as, preparing meals in a microwave, grooming, so brushing their teeth, brushing their hair, building up their endurance, so how long can they stand for, and also setting goals. So, setting goals to reach certain amounts of time standing, to reach certain amounts of distance walking, building up their endurance. So I would focus on practicing those activities of daily living. How do you determine whether a treatment activity is effective for a patient? Share an example or a scenario where you might need to adjust an activity to better meet an occupation-based goal. Good question. Okay. So I would say you determine whether a treatment is effective for a patient or not by checking up on their progress, right? So as you're documenting throughout the weeks or the months or the days that you're working with somebody, you want to check from the first day you worked with them to the current day and see, are they improving? Are there improvements? So I would say, for instance, say we once again have somebody come in who is having respiratory issues, breathing problems, and we've decided that we are going to practice sit to stands. We're going to practice walking down the hallway, building endurance, and seeing how far a person can walk while still being able to breathe and feel good. I would say, if you start week 1 and they're walking, 50 feet, and then week 2, it declines a little bit to 45 feet, and then week 3, it declines a little bit more, I would say that's when you know that something's not working. Something's going on, and there maybe needs to be a reevaluation, a check-in, just to make sure that the patient is able to figure out, what needs to be changed in order for them to reach their goals. So to touch back on the question, how do you determine whether a treatment activity is effective for a patient? Share an example where you might need to adjust an activity to better meet an occupation-based goal. So once again, I would say if your patient is showing no progress and they're not growing since the start, something needs to change, and there needs to maybe be a reevaluation or an adjustment in the exercises that you're doing with that patient. Okay, question 3. In your opinion, what makes an observation report accurate and useful? Discuss how you would handle a situation where you're unsure about a particular observation detail. So I would say an observation report that is accurate and useful is going to be documented properly and truthfully. So when we're working with a patient and we're observing them, we want to document the correct timing. We want to document the correct date. Where are we? What are we doing? We want to use as much detail as possible. Who's in the room with us? Who's performing, the assistance? Who's helping the patient? So I would say that those details are what's going to make an observation report accurate and useful. How would I handle a situation where you're unsure about a particular observation detail? I would say you need to communicate with the people who were also in the room with you. So at my field work, a lot of times we would be working with nurses and we would be working with physical therapists. And I noticed that whenever there was something that Kinsey was unsure of, she would communicate. There's a lot of communication going on back and forth. Hey, how long did this patient stand for? What time did we start? What time did we go? What were her vitals? Communication. And, trying to be as accurate as you can with documentation. Okay, so consider a case where a patient's progress seems inconsistent. How would you ensure your observations capture both the challenges and improvements accurately? Okay, so working with patients who have suffered strokes. So I noticed a lot of days, some of these patients had really great days, and then the next day we would come in and they would just be in a bad mood. They didn't want to do anything. Maybe they were in more pain than they were the day before. So there were a few instances where I did notice some inconsistencies going on. So I would say, how would you ensure it's our case for a patient? So I would say, for example, people can face inconsistencies maybe when they're not receiving consistent medication, maybe when their diet is inconsistent. It could be even something as simple as, if their nurse is not taking proper care of them and bathing them regularly, changing them regularly. That can really affect a person's health, a person's mental health, their ability to want to do things. So that can affect a patient's progress. So how would I ensure that my observations capture both the challenges and improvements accurately? I would say really by focusing in on how a patient feels throughout a session, consistently asking them, okay, how are you feeling? What did you like about last session that maybe you hope to do more of? What do you not like about the session that we're doing right now that you feel like is not working for you? So I do feel like, once again, really communicating with not only the patient, but also the other staff, just to ensure that there are no medication changes, diet changes, anything like that, because that can all cause inconsistency with patients' progress. Question 5. So, what are some ways you could show initiative in a clinical setting without overstepping boundaries? Share examples of tasks or interactions where initiative can make a positive difference. Yeah, I experienced this a lot at my clinical. So some ways to show initiative without overstepping, especially for field work level 1A, would be doing small things like locking a wheelchair, refilling ice water, pushing a wheelchair, maybe moving tables, lowering beds, simple tasks like that, because, we can't really do too much right now. We're still in school. We don't have all the skills, but I know that in my experience, I kind of, observed, and I kind of stayed back because I didn't want to get too in the way of my therapist and her patients, but I also made sure to always be there if my Kinsey needed anything. So if she needed a fresh water refill for a patient, if she needed me to, go get something for them, maybe fresh towels, sheets, doing stuff like that is a world of difference, and it saves the therapist time, it helps them out, and it gives the therapist more time to work with the patient one-on-one. So that was super helpful during my field work. Okay, discuss how showing initiative in patient care activities could enhance your learning experience and positively impact the healthcare team. Showing initiative is huge. So showing initiative teaches the people around you that you go above and beyond, and that you're not a lazy worker, and that you're not going to sit back and just kind of just let things happen. Showing initiative shows that, first of all, you care. Second of all, the patients are in good hands, right? You're somebody that the patients can trust. And showing initiative shows that you are a leader. It's a good way to show that you are a medical professional who can be trusted. So yeah, showing initiative in patient care is never a bad thing. It's always going to leave a positive impact, because it's going to show that you are willing to go above and beyond for the care of your patients and for the well-being of your team. You want to have your team's back. So that's what I would say for that. Okay, think of a time when communicating with a patient, family member, or healthcare professional might require special attention to tone, clarity, or sensitivity. How would you approach this interaction? Okay, this was another huge thing that I witnessed at my field work. So I would start by saying everybody is different. We all have different personalities, we all have different cultures, different beliefs, different ideas. So we need to learn how to, as therapists, we need to learn how to communicate with people effectively in order to, first of all, one, let them know that we respect them. Two, let them know that they can't push us around or take advantage of us as healthcare workers, right? We need to be, for some people, you might need to be a little more stern and have a little more boundaries than others. I would say some patients also are a lot more anxious than others. So we need to learn how to communicate with anxious patients. We need to know how to change the tone of our voices to be therapeutic, to let the patient know that it's okay, and we're here with them, and we're gonna keep them safe, and everything is gonna be okay. So some patients are gonna be maybe a little overly confident and feel like they don't need your help at all. So learning how to manage people like that, and then also people who are highly anxious and need therapeutic reassurance that everything is okay. So we need to be able to kind of change our tone of voice and how we communicate with people. That's a huge part of the job. Okay. How would you handle a situation where there's a misunderstanding with a colleague? What strategies would you use to communicate professionally and resolve the issue? It's another thing I witnessed at my fieldwork. So, communication is key. Communication is key. And this is something that I sometimes struggle with. I think that being open, being honest, and just stating your needs as the therapist, stating the patient's needs, speaking up when you feel like something's not right, but also doing it in a respectful way. We always want to be respectful of our patients and our coworkers. I think another thing too that I learned is you have to know what situations are worth battling for, and what situations you have to just kind of take a deep breath and walk away from. So yeah, misunderstanding with a colleague, I would say, pulling them to the side and having a respectful conversation and saying, hey, what happened? Can you explain to me, what's going on? I think that's the best way to handle conflict. So that's what I would say to that. Discuss a scenario where understanding a patient's cultural background might influence your approach to treatment. How would you adapt your interactions or treatment plan to respect their cultural values? How do you think this factor influenced the client's occupational performance? How may it have shaped the treatment planning process? Yeah, so culture varies so much, and culture differences change the way people do things, changes the way people behave, changes the way people interact, right? It changes, it's different in every culture. So personally, I think that if I know I'm gonna have a patient who's from a different culture, I'm gonna want to, number one, meet with them and the family or whoever their caretakers are first and get my own feel for who they are, what their preferences are, all that. I'm then gonna want to, number two, do my own research. I'm gonna want to look into how to properly behave and communicate with that person. So culture can most definitely change the way we create plans and treatments for patients, right? Because some people in different cultures maybe handle grooming differently. Maybe they handle, interactions with doctors differently. So something to be aware of is sometimes we might be confused, or maybe we might feel offended by the way somebody's speaking to us from another culture, or maybe we're confused by their ideas, their roles, and familial roles. So I would say communicating with the patient first to understand who they are, and then doing your own research and gathering as much information as you can about their culture. That way you can move forward confidently in the treatment plan, and avoid any uncomfortable interactions or possibly offending their culture. So that's how I would handle that. And if we don't do those proper steps to learn about a patient's culture, that very much could impact the discharge planning, right? It may cause confusion. It might really limit a patient and their ability to progress, because we might be teaching them things that don't make sense, right? We might be teaching them how to do things a completely different way than they originally do in their culture. So that could ultimately kind of waste a person's time. So we don't want to get ourselves into a situation like that. We want to make sure our treatments are fitted to that patient and their culture, their cultural needs. How can healthcare professionals develop awareness and sensitivity to ethnic and cultural differences in ways that enhance patient rapport and trust? I would say, once again, research, and I also think that depending on the area you're in and monitoring what types of cultures, what types of people are coming into your work setting, really paying attention to that. And then as a staff, maybe the supervisors, directors can make it a point that each month there's lunch and learns, there's resources that can be sent out to the staff that can educate the staff on the cultural differences that they will be facing in the workplace. So educating the staff. What are some ways you can demonstrate professionalism in your interactions with both patients and staff, even in challenging or high stress situations? Paying very close attention to how we communicate, our body language, making sure that we are being respectful. We can be stern, right? We can have boundaries and we can say when something is not right, but we always want to remain professional. We don't want to cuss. We don't want to scream at people. We don't want to make people feel stupid or dumb. We want to remain professional because we are the professional in the room. We're the therapist. So learning how to manage our own anger, our own frustration, and learning how to stay calm and respectful is very, very important. Discuss a situation where maintaining a professional attitude might be difficult. How would you handle it to ensure responsibility and professionalism are upheld? Yeah, a situation that might be difficult to remain professional is when you have a difficult patient. So a patient who thinks that they don't need our help, they know how to do things already. Occupational therapy, this is silly, I don't need this. So those types of patients can be tough. And something that I learned at my fieldwork was, as tough as they might be, you have to stay professional and you have to stay respectful. So yeah, I would say dealing with patients who don't want to work with you, that's going to be a situation that's going to be very difficult and very hard. So we have to learn how to get through that. In what ways do psychosocial factors impact a patient's performance in therapy? Share an example of psychosocial factor you might encounter and how you would document it. Anxiety. So, anxiety can affect a person in so many ways. It can affect their ability to participate. It can affect their ability to socialize. And I did experience a lot of patients, elderly patients who were facing a tremendous amount of anxiety, and it was very limiting for them. They really, they faced a lot of struggles because of it. So I would say you have to be very clear in your documentation. So what did the patients say? What did they say? How are they feeling? How are they performing the tasks that we're giving them? You got to be really clear about what you're seeing and what you're hearing from that patient. So, how can understanding a patient's psychosocial background improve the effectiveness of the treatment you provide? Discuss ways to observe and report these factors accurately. Yeah, understanding a patient's psychosocial background can be a world of a difference. It can be so helpful because once again, everybody's different and we don't know what everybody's facing on the inside in their brain. We don't know the struggles that they've been through, the emotions that they're feeling, the traumas that they've faced. So I think building a trusting relationship with somebody, showing them respect and giving them a space that they feel safe enough to open up in is very important, because we want to understand, okay, why is this patient facing so much anxiety? Why is this patient facing such a lack of confidence? So it's important to create a trusting and safe environment in order to understand what's going on in the patient's mind is very, very important for a patient to be able to progress in their treatment. And ways to observe and report, the patient's psychosocial background, once again, is paying attention to what they say and how they act, and their reactions to the treatment plans that we give them. So those are all of the questions. And then let's see, during your clinical experience, what social determinants of health did you observe or learn about from your clients? Yeah. So I would say social support was a big thing I noticed. There were a lot of patients that did not have social support, which is heartbreaking, and it's once again very limiting, because a patient who doesn't have social support lacks a lot. They lack assistance in their daily activities of daily living. They lack assistance with, getting clean clothing, food, help cleaning their house, help with transportation, help emotionally. I would say that's the biggest thing. Socializing is a huge part of how we, keep our emotions stable and we feel connectedness. And so I noticed a lot of patients that did not have family that were supporting them and did not have, spouses, which I think as a result, they suffered from a lot of depression, and they didn't have access to all the assistance that comes along with family support. So having family is huge, and having family that's willing to help is going to help a patient recover quicker. And I would say I experienced this with more than one patient, and their levels of sadness were a lot higher than patients who did have family support. Patients who did have family support, I noticed, had more motivation. They had more encouragement. They had, people bringing them fresh food, fresh clothing, medication that they needed. So, yeah, social support is a big one. It makes a big difference to have a team of people helping you. So, once again, my name is Julia Gross, and this is my Level 1A Fieldwork video reflection. Thank you so much.